I think you can read. Are you able to see the screen clearly? Dr. Beatrice, can you see the screen clearly? Okay. So we have the DHIS data showcasing teenage pregnancy in Busia County. Let me put it at 200%. So we are looking at the ages 10 to 14 years and 15 to 19 years. So in total in Busia County, adolescents, girls aged 10 to 14 years who presented themselves with pregnancy at the first antenatal care visit were 187, while those ones who are aged 15 to 19 years who presented themselves with the pregnancy at the first ANC visit were 5,512. So if we go down and look at the breakdown of teenage prevalence of teenage pregnancy per sub-county, in Bunyala sub-county, for adolescent girls aged 10 to 14, 8 of them were pregnant, and this is the year 2020, while 15 to 19 in Bunyala sub-county were 384. In Butula sub-county, 19 girls aged 10 to 14 years got pregnant, while those ones aged 15 to 24 were 1,220. For those ones who are aged 15 to 19 years, in Butula sub-county were 1,224. In Matayos sub-county, 65 girls aged 10 to 14 presented themselves at the health centers, all right, during their first ANC visit, while 925 aged 15 to 19 years presented themselves at the health center for their first ANC visit. In Nambale sub-county, it recorded 16 young girls aged 10 to 14 years who were pregnant, while 662 aged 15 to 19. In Samia sub-county, 13 girls aged 10 to 14 years presented themselves at the health center to attend the first ANC visit, while 606 aged 15 to 19 years presented themselves at the health center. In Teso North sub-county, 56 girls aged 10 to 14 years got pregnant and attended the first ANC visit, while those ones aged 15 to 19 were 883. In Teso sub-county, 10 girls aged 10 to 14 years presented themselves at the health center to receive the first ANC visit due to pregnancy, and 828 presented themselves at the health center, and they were aged 15 to 19 years. So that is the prevalence of the teenage pregnancy in Busia County. So we have on board David Buluma, who's going to share his experience as a young father so that even other teenagers can get to learn about his experience, as well as the policy makers who have attended this forum. All right, David.
My name is David Onei Buluma. Yeah, I'm 26 years old by now, but I got my child 4 years ago. Being a father at a teenage age when you are not yet married is a great challenge and a very big challenge because lot of things which you never expected to happen do happens. And a time like this when someone is still schooling and at the same time being a father is something that someone has to go through a lot to manage the family and more so the child. Specifically talking to currently, after my schooling, I've not yet got any job. And as per now, I'm a fisherman. Yeah, I do fishing at Lake Victoria, at least to sustain my child and ensures that at least she gets everything she needs. But what I can tell the youth and what I can also advise the youth to always do, getting a child at a tender age, and more so when you are a boy. You know the county government, and not only the county government, but let's say the government of Kenya, do judge things wrongly, and they always see it as if the boy child is one who has made the mistake of impregnating a girl, but it's not always our wish. So I would always like, uh, to my concern, I think the government should be considerate by considering those of the boys' case, because sometimes we always seek advice before the happenings, and we even also suggest some of the happenings to our friends, but they don't listen to us. But when the government starts to handle the boy child, they handle the boy child as if it was a forceful thing. But what I can say, after having my child, by the way, my child, I named my child after my late mom. Her name is Dina Betty Olor. After getting my child, I just think things were not moving the same way they used to when I was not still a father. Financially, I had to go down. I had to go really down because earlier it was only me and me alone. But as I'm speaking to you, it is me and someone depending on me. So as the same way I used to treat myself, I think it's the same way I'm treating my child and better. And that's why financially I think I'm really down. But my advice to the youth is that let them not think that getting a child at an early age is a great blessing as they used to say it. I like to tell my fellow youth that that thing is a blessing when you are in marriage. But when you are not married, it's not a blessing, and I think it will never be. Please let be observant of ourselves and let us behave ourselves. And to the county government, I think to my point, you need to call the local authorities to board and at least train them on how to handle youth. Because you are making these youth to be afraid, and people are really fleeing away. More so here in Bunyala, most of our boys are fleeing away from this place to Uganda in fear of being imprisoned because of just being a teenage father. You look for a child, you look for the boy, you see policemen, and you just give out threats to the parents that the boy will spend almost 30 years, 40 years, and when the boy disappears, the child who has not yet been born or the child who has been born ends up not, not having a father, or ends up the father ends up living the whole life in Uganda just because of the local authorities, just because the local authorities threatened to arrest him and put him in prison. So I think the local authorities should be considerate of what they take as far as the cases are always concerned. I think that's all I have to say. Thank you.
Okay. Thanks, David, for sharing your experience. So right now, Juliet, kindly share your journey with us.
Hello. Hello?
Hello. Yes, continue.
Mimi sina mengi ya kusema, lakini nasema kuzaa kama bado wewe ni mdogo mbaya sana. Juu niliona vile nilikuwa na mimba kama bado nimemaliza shule, it was 2018, nikapata mimba, nikafukuzwa nyumbani na nikaona ni maisha yenye naenda ni ngumu. So nilitoroka nyumbani nikaenda kwa dadangu mkubwa, nikaishi huko, akanilinda, nikamaliza hadi na kuzaa. Nilijifungua vizuri. After 3 months nikaamua nikarudi nyumbani. Kutafuta vile mtoto anakula, wewe mwenyewe unajilinda ni hard sana. Sasa nashauri marafiki zangu wenye bado hawajazaa wajilinde, watazalia huko kama wameoleka. Ni ngumu sana kuzalia nyumbani, ni vyema kuzalia kama bado uko kwako. Sina mengi na hayo tu, asante.
Haya, karibu Juliet. So Juliet, uko na mawaidha gani kwa government? Uko na mawaidha gani kwa serikali?
Mawaidha sina, lakini itutafutie kazi, at least sisi pia youth tupate kazi. Sasa mimi nilimaliza shule 2017, bado sija join. Niki apply basari sipewi. Hiyo tu ndio nawaambia Busia County iweze kutupatia basari tuweze kukilia fees zetu zenye bado ziko shuleni. Tuende tulete ma certificate zetu kama tunaweza join college skills ku train, it's better. Thanks.
Okay. David, na wewe uko na mawaidha gani kwa serikali? Ama ni nini unataka kuambia? Okay, hawezi tusikia. So at this particular period of time, I would like to bring in Dr. So that she can share her feedback. Dr. Beatrice, you've heard what the adolescents have, the young parents have shared. So what do you have to say What's your take on it?
Yes, thank you, Karibu, Alice, and the others. We had the two young parents who started sharing. That was Juliet and David. Juliet had gotten her baby after finishing Form 4. And the experience she went through is that when the parents realized she was pregnant, they chased her from home. And thanks to her elder sister who hosted her until she gave birth, she was able to come back home after 3 months after delivery. But then things did not really were not very easy because all the time issues, life was hard. David did the same experience. He got his baby when he was at 22. And the challenges that he got was he had to really do manual jobs in order to be able to provide for the child. And as at now, even though he has finished school, he has not been able to get any job. And he has found himself now going to Lake Victoria to do fishing so as to be able to vend for his child. The last person who has shared, I think Madam Alice was on board, so I don't need to go back to that. But there are the challenges that the young parents shared about. One of them is that they would wish the county government of Busia comes up with life skill training for the young people so that even as they look for jobs to be able to provide for their children, they can earn a living. The other requirement or a request from David was that the county government needs to consider the boy child. And it really pains me and it touches each person's heart to learn that most of the young parents, particularly the boy child, once they become parents, many times they are threatened by the parents of the girl. And as that now, David is telling us that most of those people have run away to Uganda because they are scared, they are threatened, they will be arrested and put into prison. And so they move away to other places. And so David is asking the county government, please be sensitive to the boy child. And the request for training to the youth that has also come up from Ghana. So we do realize, and the young people, the young parents are saying they face a lot of challenges. Some of them is the fact that they get stigmatized. The society does not appreciate them. The parents don't appreciate them because they have failed them as good boys and girls. The church will excommunicate them because they are not living upwardly as far as moral standards are required. And so the request is that the county government comes up with a budget. And I would add on what I said also on my side, because Madam Alice was not around, that it is high time the county government addresses the issue of young parents. Chasing them away from home is not a solution. Chasing them away from church is not a solution. And even stigmatizing them is not a solution. We need to address the issue because it is with us. The county government should have a budget that takes care of training these young parents in life skills. And then lastly, as we await and jungle with COVID as at now, the children are staying home for longer times than any other year. And if these young people are not occupied, and this is where the department with the youth needs to come on board, come up with the programs to address and to occupy these young people. Otherwise, when we leave them idle like they are now, many more are going to get pregnant. And imagine as at now, the statistics we were given is that Busia County had 5,699 young parents. So this is a big number that needs to be looked into to have help. Thank you.
All right, all right. So Mercy, you may start off by asking Madam Alice Yaite the first question.
I repeat the question.
Yes, yes, yes.
Okay. My question was, how many youth-friendly centers are functional, and how many are in the pipeline, and how is the uptake of services in those centers, and what is the Busia County doing about it?
All right. So Madam Alice, over to you.
Thank you very much for according me this opportunity. First and foremost, I want to say that the issues of youth need collaborative efforts. We need to collaborate with the church. We need to collaborate with the other sectors like youth and gender. We need to collaborate with the Department of Education. We need to collaborate with the Department of Youth and Sports. We need to collaborate with everybody. Then maybe we need a body that brings all these sectors together. Because for me, as RH coordinator, I'll address the issues of youth from the perspective of their health. So in order to answer the first question, I want to say that we don't have a youth-friendly center per se as such, but we are trying to integrate our health services. We want to integrate the youth-friendly into our day-to-day health service delivery. Because one, you're talking about the issues of stigma. If we separate a youth center separately, there's the issue of stigma. Two, we need extra staff, extra infrastructure, and what have you. But we have a big hospital that is coming up of mother and child health in Alupe, and we've tried to factor in the issue of youths so that we have a specific room in that place for the youth. But as we speak, we are integrating those services. We tried to come out with a youth-friendly center in Nambale, but it didn't take up very much. So that's what I would mention as per now. Regarding the uptake of services, you know, from the health perspective, we have quite a varied number of services that we offer. Regarding the maternal and health, you'll find that, yes, we have quite a high number of youths who come to access our antenatal clinics. I want to mention here that if you look at our figures for antenatal, about 50% of the pregnant women who attend our antenatal clinic are youths. That is about the age of 19 to 25. However, we may have a few under 15 years old. But one problem we've been trying to find out, and we try to work with a partner, is to answer a question. Are we dealing with the youth teenage pregnancies who are in school, or are we dealing with early marriages? Because for Busia also we have the issue of early marriages. You've had those youths telling you that when they discovered they got pregnant, they were rejected by their parents. Most of the time they'll tell them, go to whoever made you pregnant. So we were working on a tool, we developed a tool, and we managed to sample 5 secondary schools, 5 primary schools with very high rates of teenage pregnancies across all the 7 sub-counties. So from and we had a meeting between the healthcare workers, we took them through the tool, and the teachers attached to those specific health facilities within that catchment population. The challenge we faced at that particular time was when COVID came in, schools closed, we were not able to get data from schools. But from the health facilities, we have that data because these youths come to the health facilities for antenatal care. So we are able to say, yes, youths are accessing services for that matter. Even we can be able to say that among the women who come for skilled delivery, this proportion are youths, this specifically. But the question we are asking, are we dealing with youths in school or are we dealing with teenage, with early marriages in our county? So that is something that needs to come out very, very clearly so that if we are dealing with the early marriages, then the issue of life skill comes in. What are we going to do to these young people who get married very early? I heard somebody saying that the youths are forced to run away because of stigma, because they are threatened by their parents. So we need to go back to parenting. What is why do we have very high rates of teenage pregnancy? What is the role of parents? What is the role of the church? What is the role of the youth themselves? Are they trying to have sex for fun, not putting into perspective the outcomes? You heard David saying that most of them, they may not understand the outcomes. For them at that particular time, maybe they want to enjoy themselves or they want to experiment themselves. So how are we, Violet, going to come in and talk to the youths? What are the consequences of engaging themselves in early sex? And we do sometimes do school health, where we go and talk to the students or the teenagers in schools about sexual and reproductive health. However, when COVID came in, schools were closed. When they opened, the teachers told us, no, we are very busy with the exams. We could not reach out to the youth. Because maybe we also need to reach out to the youth and start talking about the basics, about the basic biological aspects of their body. When a child reaches adolescence, what do they expect? Maybe that is where the missing links are. Hello?
Yes, we can hear you.
Yes, back to you.
Yeah, so at this period of COVID-19, we've seen that there is also decreasing support from donors. So how can Busia County best finance initiatives to reduce teenage pregnancy and improve health indicators over the long term, particularly for vulnerable teens?
That's why I mentioned that teenage pregnancy is not only a solution to the health sector, because you must agree with us that there are never enormous resources. The resources are so minimal. And for our budget, yes, the county government allocates a bigger source of the budget to the county, to the Department of Health and Sanitation. But however, you'll appreciate that a lot of that money goes towards salaries and remuneration. So the little amount of money that remains in the budget is left to share along all the other needs of the department. So you'll find that maybe even if we allocate resources to the youth-friendly issues, it is just a very small proportion. So maybe we need advocacy. We need to collaborate with the leaders. We need the teenagers to come out and actually advocate for more resources. Because if the health department gets more resources, then you'll find during the allocation, a little bit more resources will go towards the youth or reproductive health care services. But where the resources are minimal, it's very difficult. Because now you'll have to prioritize. What will you prioritize? You'll prioritize a salary, you'll prioritize drugs. These preventive services become like secondary now because of the minimal resources.
All right. So even we can see a call to action there where you are challenging like even teenagers. They can also engage in championing for increase in budget allocation towards curbing also teenage pregnancies. Yeah, that is a very good call to action. That even the CSOs in Busia County should also factor in even in their project work. All right, because you know, when the voice of the adolescent is being heard by the policymakers, it usually causes the policymakers to listen in to their plea, because they can now hear the voice of the of those adolescents. So it is good to also have adolescents even at the decision making table. So Madam Alice, I'd like to ask you, do you have a technical working group on adolescent health in Busia County? And are there adolescents or young people who are in that particular technical working group?
As I told you, I think we have a TWG, but it's controlled by the Department of Youth and Gender, where we join in as stakeholders. But for us in the Department of Health, we have what we call a reproductive health TWG. So how I wished that those other stakeholders would have been in this particular meeting, like the youth, the Department of Youth and Sports, because they're the ones who have that TWG.
All right. So you've mentioned that there is a technical working group on reproductive health.
Yes.
You have a technical working. So then that means if there is a technical working group on reproductive health, then maybe you can bring in a civil society organization to also who also champion reproductive health to join that particular working group. What's your take on that?
We have many stakeholders who join in the TWG. We have the partners, we have the children's department, all those people who deal with something to do with youth. But you see what we are saying now, who controls the youth affairs? Because we have the Department of Youth and Affairs.
Patricia.
So who that is what we need to come out clearly in our county, so that not everybody does piecemeals. The health sector is doing its piecemeal. The youth and sports is doing its piecemeal. The children's department is doing its piecemeal. The education sector. So how can these people all be brought about on one table? For example, we've been telling the CSOs who deal with youth, when you are going to address that youth, how can the health sector come in? So that we join you when you are going out. You know, we could be having a technical expertise. For example, we want to talk about family planning. When you go to the field, you are going minus the healthcare worker. How do we go along? At one point, they agreed that yes, we've realized we are leaving behind the healthcare worker. But now, where can we have this umbrella body that brings all these sections so that we are talking to this youth in one voice? When we are going to reach the youth, we are approaching the youth from the health perspective, we're approaching the youth from the religious perspective, we're approaching the youth from educational perspective, so that we don't, today I'm going with health, I come back, tomorrow somebody is going with a different thing. If we can amalgamate our resources together and synergize one another, that would be very good. Because we have limited resources in the Department of Health. We may be having ideas. We want to reach out to the youth there with information, with education, but we don't have the ability to reach there. But if a CSO comes and says, Alice, I have a youth camp, are you able to join me so that you can talk to these youths about sexual and reproductive health? Are you getting what I'm trying to say? It would be okay. Yes. But I think apparently it seems like everybody is reaching the youth with its own section. So it becomes very difficult.
Yeah. So what we are getting is that you're saying that even the CSOs in Busia County, they should work closely with the like the ones who are working on reproductive health. They should work closely with your department, because all of you are championing for the same thing. Yes. And you're also and you're also saying that even them, they have resources, that it will be good for them to partner with you, so that you may reach these young people, like even the adolescents, to curb teenage pregnancy. So I think right. that is very clear, and yeah.
Because Violet, when we talk about resource, there is it is vast. We have the human resource, we have the financial resource, we have the materials we have. So how can we capitalize on these minimal resources that we have? Because I may not, for example, you've been telling me you are doing something in Bunyala. Then if the gentleman whom you are talking with was the sub-county RH coordinator. But he's saying he doesn't know you people working in Bunyala, you see? So it becomes very difficult. So if we can learn to work together, if we can learn, I may not have the money, but I can ride along you and reach still that youth with something useful. But so long as we work separately, kila mtu anaenda kule kivyake, we may not achieve more.
So I think that is also another call to action to curb teenage pregnancy, and that means there being a unified approach, like partners working together, even the CSOs. Wow, that's awesome. So Mercy, do you have another question for her?
Yes, I have a question. You've talked about collaboration with both parents, churches. Is there a sensitization approaches that you've used to bring all these stakeholders together to help you work together towards this goal?
I will say no. Because for us, maybe we work through the TWG, the Ramka TWG. We hope that when we work with them, they're able to pick issues and take out to the community. But we've not directly gone to the community to talk. Maybe when we have an outreach, maybe when we go to the camps, like now, I would say in Bunyala, the COVID came in with the floods. So the youths were displaced and they were in the camp. So that's how we're reaching to them with information about sexual reproductive health and maybe what services are available for the youth, but not on a wider scope.
All right. So, like, the other question that I have for you is, what plan does Busia County have in their annual work plan that is yet to be developed? What plan do you have in your annual work plan that is yet to be developed? And can you include key activities to support adolescent reproductive health? And what are the priority activities?
I want to tell you that in our county, we had a reproductive health strategic plan, which ended in the year it was developed in the year 2017, and it was a 5-year plan, which has just ended. We've been trying to look for supporters so that we can review that strategic plan and put. But that strategic plan had a lot of issues to do with the youth and reproductive health issues. So yes, we had one, but it had expired. We are looking forward towards reviewing it and developing another one.
All right. So, Ganning has a question for you. So, Ganning, kindly go ahead and ask Madam Alice your question.
Okay. Madam Alice is addressing many issues, and as we can see, there are a lot of gaps which are actually, there are no strategy of filling them. And that is why I've typed there, if the stakeholders are ready to come together, because he's saying there is the health part, there is a sport and gender, and they are working independently. What if they can come together now and form, and then bring in this organization, bring in Border Hub, then they strategize a way even to reach to the churches, because that is when we can fill in the gaps and then reduce these statistics, because this statistic is one thing. Because talking about 5699 pregnancies, I actually doesn't reflect. So my question is, are these stakeholders, or has Madam tried to reach them now if they can work together as a team?
All right, Madam Alice may respond.
As I told you that we've been having a stakeholders meeting, but not, I think the COVID issue, when the COVID issue came in, that physical meeting apparently is not working very well because of the restrictions from the health sector. But I think recently we had a virtual meeting and we tried to discuss the issues to do with adolescents. But we've not really, there isn't a very good roadmap as such. So I don't know how we are going. That's why I'm asking, who is responsible for the youth issues? If we know who is responsible for the youth issues, because as we speak, it's like everybody is just, what can I do for the youth in my sector? What can the education office do for the youth in this? What can the health do? But if we'd get that umbrella body and put everybody on board and say, this is the chair. Because what happened when we were trying to map up the issue of youth and the education, our chair at that specific time was the county commissioner. We brought in the county commissioner because he was neutral and he'll bring everybody on board. Unfortunately, that county commissioner left. We have a new person in the office. So we have to start the process afresh again. So that is the situation we are in.
Wow, wow. So, my take on this is that I think like the CSOs in Busia County should pay a courtesy call even to the ones who are working on RAMCA. They should pay a courtesy call to the RAMCA, to the Reproductive Health Department, so that they can discuss how they can collaborate in the work in curbing teenage pregnancy in Busia County, because if everyone works works solo, that is in isolation, you will not be able to achieve the zero pregnancies, teenage pregnancies in Busia County. So I think what is coming out is that there is no, what can we call it? There is no collaborative approach between CSOs and the health department. And I think that from even this webinar, they will hear and they are going to act accordingly. So do you have any question for for Madam Alice, Dr. Beatrice, or any
Yes,
comments?
thank you, Alice. And I can also put myself in your shoes, because the biggest question that you are having is who is in charge of the youth? And from the discussion and what we have seen from other counties, my proposal would be the county person who is in charge of the youth welfare at whatever level should call together all the CSOs that are working within Busia County and all the other stakeholders, come together and be able to agree on how to address the issue of youth pregnancy within the county. Otherwise, as Madam Alice says, it is not possible for each person to work on their own on a standalone and be able to achieve to address the issue. Madam Alice, by proposal, in addition to what you are doing as you get together the youth programs, is that you during that umbrella, there should be somebody or an organization that should be able to come up with the support group programs for these young parents. Because when we ignore them, nothing will happen. We need to empower them so that they can be able to provide for themselves and even for their children, and be able to move on with life, because life has not come to an end simply because somebody has become a parent, and this is very essential. And as you think about the support group for the young mothers, think about support groups also for the young fathers. let's not ignore the boy child. Otherwise, Madam Alice, I can hear you and I can imagine the pain you are going through, trying to get to know exactly who is the person to address this issue. And then as the bigger group comes together, the CSOs should also be able to advocate for funding for these programs, because the county cannot ignore the youth because they have gotten pregnant. They need them. They are the leaders of tomorrow. So there should be programs to meet their needs. Thank you.
All right, all right. So, Mercy, do you have any comment or a question for Madam Alice?
And then maybe, Violet, just before I let go, Madam Alice, I can see there is this, was he De Gracious is requesting that you partner with him, because through the program that they are doing in the county, the hub, the Busia hub, I think that's something that you need to follow. And also get to know the counselors around the county. The counselors, the professional counselors will be able to help you a lot in really making the youth to know who they are and why they need to wait. The pastors might say, read the Bible, but the counselors, the professional counselors are needed to work with the youth also. Thank you.
All right, all right. So, Mercy, any concluding remarks?
It's just to appreciate Madam Alice. You've brought a different way of us in the way to go forward, to have one voice even as we come in to help and assist the youth and the teenagers. Working as one goal, like speaking the same language at one place, it will really help the youth and the teenage parents. Thank you. And the teenagers, sorry. Thank you so much for bringing that aspect.
All right. Ganning, do you have any concluding remarks?
Okay. The problem now, what from this conversation, what I've seen, we look at the solution, but we don't look at the cause of the problem. And I think after this, the people concerned may try to look at where the problem comes from before coming to the solution. Because if you have the problem and you understand the problem, now the solution will be simpler. And like now, where Alice, they are handling the health, how is it called? These of family planning stuff, but they don't handle like mostly the boy child, because for a pregnancy to be there must be a male and a female. And now who the people of concern most to the health fraternity is the female. Now what of the male? Now if we can look at the problem in the broader view, we'll have a solution which will create an impact within the county. Thank you.
All right, all right. So, Ganning, kindly introduce yourself to Madam Alice so that she can get to know more about you. Introduce yourself.
Okay, I'm George Ganning. Yeah, I'm a resident of Busia, and I was to talk as the capacity of a parent. Yeah.
All right. So, if you
but
want
I'm really
to continue. Yeah.
Yeah, I'm really for the boy child rights. That is what I'm advocating. I need that platform. Right. I'm not on that platform, but that is what I really want. Yeah.
Yeah. So I think what you can do, George Ganning, is you can pay a courtesy call to Madam Alice, and then now you can chat a way forward on how the two of you can work together. So, Madam Alice, any conclusion? All right, Madam Alice, any concluding remarks?
Yes, I want to encourage the CSOs in this forum that if you've got anything you are doing regarding the youth in terms of health, kindly visit the county directors of health. They are available at Inyanja Plaza, third floor, so that we put our thoughts together. Even Gunning, you are free to come and visit us at Inyanja Plaza, the county director's office, so that together we can churn forward. So for this congregation, I want to say that youth and adolescent, there are so many perspectives of it. We can approach it from the health perspective, education perspective, from the church, from the parents, and all over. So for us to be able to succeed, we need to bring our thoughts together. How can we handle this? How can we synergize one another so that at the end of it, we are achieving the objective or the purpose so that we have a brighter future for this youth? Mr. Gunning says that he's representing the parents. I want to encourage parents that when a girl becomes pregnant, it's not the end of the world. And chasing her away, scaring, threatening the boy so that they can run away and go to another country. Like for us here, we are at the border. It's not a solution. How can we talk to these adolescents so that they can go through the pregnancy? I thank God because I got those girls giving their testimony. Some of them try to abort, some try to commit suicide. So how are we going to encourage these youths that so that it's not the end of the world? Even after they have given birth, how can we take them back to school, or how can we take them to life skills so that they can be better people than what we are seeing? So we need also to talk to the parents, because what is the perception of a parent when this girl becomes pregnant? uh, how are we handling the youth? Because in the rural aspect of this county, you'll get the youths do their own things without guidance from the parents. The parents are in their own world, the youths are in their own world. The parents are not taking care of youth to an extent that sometimes they don't even provide sanitary pads. So these girls will tend to go and look for money from the people who have it. Then what becomes of it? They become pregnant. So how can we loop in parents also so that they can be shown their role? What are their responsibilities at the family level when the girls become pregnant? How do we handle both the girl and the boy? Because sometimes maybe it was just by bad chance. eh? It was not their intention. But how do we handle both the boy and the girl? Because if we start threatening them, if we start scaring them, then it will be unfortunate. For that girl, she was lucky her elder sister took her. What about that one who doesn't have anybody to take her? What happens to them? So I think those are things that we need a forum where people can discuss these things broadly so that when now we look for solutions, we know where the problems have originated from.
All right, all right, all right.